Very good evening, all the medicos listening to me. Can you update in the chat box? Is audio video fine? Is audio video fine, beta? Can we start with the session? Very good evening, everyone. Let us start, and I promise with our next couple of minutes we will learn in a very fast mode, and we will try to learn how to proceed in the next 2-3 months. And take my words, beta, the game is fast learner. The students who will read the topic in a fast mode, revise the topic in a fast mode, will be on the other side of the game. Let us start with the session. Question number 1. I am showing you massive growth on cheeks. Yes, I am magnifying the slide. Image based MCQ. The first MCQ dedicated to very big, massive tumor. 14-year-old boy. My damn student will say, sir, 14-year-old boy, I will make a spot diagnosis of angiofibroma with epistaxis. Word is mentioned in the MCQ. So these both options. Very good evening, everyone. Now let us focus on the keywords. Epistaxis with 14-year-old boy. Beta question आएगा ही आएगा. 110% this MCQ waiting for you. 14-year-old boy, epistaxis. I will make a diagnosis of angiofibroma. Before proceeding for the choices, if you have revised the ENT notes 3 to 4 times, which are the 10 words? Revise with me on this platform, beta. 14-year-old boy, epistaxis, sphenopalatine foramen, dumbbell-shaped tumor, no biopsy, no debulking of this tumor, frog face deformity, Hallman-Miller sign, early stage nasopharynx, late stage nasopharynx plus pterygopalatine fossa. Treatment is surgery, which artery embolize internal maxillary artery. That's it. If you can revise angiofibroma in 1 minute, it means beta game is on your side. Am I understandable? Are you getting this point? We can win this match only if we read the things in a fast mode. We can complete the angiofibroma in half an hour when we are working in the month of Jan. But if you're working in the month of November, December, when you are appearing for the examination, angiofibroma topic should be completed in 1 minute. Let us read the option in a nice way. I'm showing you one sign. I'm showing you which sign? Posterior wall of the maxillary sinus bending down. That is Hallman-Miller sign. Let us read the option in one by one. The first option. This is angiofibroma. Yes. Digital palpation should never be done before operation. Absolutely yes. In case of adenoid, if the examiner gives the MCQ on adenoid, it should be done, but angiofibroma never done. Embolization alone should be done. No. The treatment of choice is surgery. Before surgery, we will give radio, chemo, embolize, but only embolization is not a true statement. So in this MCQ, this is your false statement. Surgery is a treatment of choice. Yes, that is your transpalatal approach for small size tumor. We can use embolization followed by surgery. Which artery we embolize? Internal maxillary artery. I hope you're getting my message. Option A, C and D are the true. Embolization alone is a false statement. Again, I'm repeating all the keywords of angiofibroma. Yes, everyone, every student. Sphenopalatine foramen, 14-year-old boy, testosterone dependent tumor, very aggressive. You can see everything is coming out. Frog face deformity, Hallman-Miller sign, posterior wall of maxillary. On this platform, let us discuss nice concept. Posterior wall bending down. Which two MCQs? Posterior wall bending down. If you close your eyes, posterior wall of maxillary sinus bending down. That is Hallman-Miller sign. Posterior wall of external auditory canal. Anyone, any student who can tell me posterior wall of external auditory canal bending down? It is sagging of the canal. Yeah, sagging of the canal, hallmark feature of mastocytitis. I hope you're getting my point. Dr. Sethi, Garg, thanks for all the compliment in the chat box. But only motive of taking this 1 hour is to give you a message that things are possible. We can read the things in a fast mode if we have a concise notes. Better. The game is of quality against quantity. We have to go with the qualitative learning. Angiofibroma, we are not here to do PhD of angiofibroma, except 10 to 12 words should be on your tips. Very good, beta. Dr. Paras, it is mastocytitis. Absolutely right. So the first MCQ cracked. Any query you can ask, you can write in the chat box. Clear? So this is your angiofibroma, frog face deformity. This is my this is your Hallman-Miller sign, dumbbell shaped tumor, nice beautiful dumbbell that is behind the maxillary sinus. Clear? Is this concept clear? Let us go one step ahead. Which option, which is used for non-invasive procedure? The examiner can complicate the MCQ. Non-invasive is transnasal approach. You go from the nose, transnasal endoscopic approach. If the examiner asks you for small size tumor, we use transpalatal. If the examiner asks you large size tumor, it is transpalatal plus sublabial approach, which is also known as Sardana approach. Important MCQ for your NEET examination. Clear? So expect one MCQ, but I am giving you 10 image based MCQs, and I promise you, but out of 10 MCQs of ENT of NEET examination, 6 or 7 from these topics. They are high yielding topic which should be on your tips. Angiofibroma is on the top. Clear? So first MCQ cracked. Any query you can write in the chat box. Coming to the next one, question number 2. 32-year-old female, make a habit of jumping on the words beta. If you read the keyword in a very fast mode, nasal bleed, 32-year-old, then examiner is wasting your time by writing some finding of hemoglobin level drop to 8, CT finding normal on examination that she has undergone nasal packing multiple times. Waste of time. Honestly, antenasal packing was performed. The examiner is giving you a slide. Now listen carefully. What is the basic golden rule? Whenever the slide is there, always focus on the slide. Then examiner is giving some histopath finding. Diagnostic endoscopy was there. There was a reddish mass on the anterior part of septum. Now here comes the important concept. Now see beta, the examiner is creating a mental pressure. This is a long history. Then there is a slide, histopath, integrated question of ENT with patho. Honestly, for me, this is a pink slide. Yes, but what is the keyword in the MCQ? Keyword in the MCQ is anterior part of septum. Anterior part of septum. It means there is some mass coming from septum. From here, I am taking you how to differentiate from nasal polyps. Nasal polyps, we rotate the probe around the nasal polyp to rule out its attachment. Here it is attached with nasal septum. Now septum, you are a damn student, you have revised the notes properly. We have 6 tumors. Out of 6 tumors, 3 tumors are on the septum. Which 3 tumors on the septum? So capillary hemangioma, papillomas and malignant melanoma. So one day before examination, you should tell me, sir, if it is red, it is capillary hemangioma. If it is dark brown, I will attempt malignant melanoma. If it is whitish, it is papilloma. Without going in the depth of this topic, I can directly jump reddish. Only 2 points, beta. Just focus on this slide. Focus on the word septum. I can manage to crack the MCQ capillary hemangioma. Very good, very nice. But everyone is attempting in the chat box. That is a big success of our notes. Okay, you have revised the notes properly. Let us rule out other option. Inverted papilloma. The word inverted papilloma. The keyword should be lateral wall of the nose. Which 2 tumors? Now, which 2 tumors are coming from the lateral wall? Always remember, lateral wall is inverted papilloma and your malignancy, that is squamous cell carcinoma. Again, I'm expecting this NEET examination, they can ask you how to differentiate inverted papilloma from squamous cell carcinoma. How we differentiate? You tell me, beta. We appreciate destruction of the maxillary sinus. So after learning, doing mastery of septum, let us do some important concept, lateral wall of the nose. If something is coming from the lateral wall, so beta aapne kya dekhna hai? You should look for, ab batao beta, everyone should write in the chat box what we will appreciate. We will appreciate. One of the students is asking me to repeat, beta. Yes, can you tell me which point you want me to repeat? I will repeat, beta. I'm here till all the queries sorted out. Yes, lateral wall. If something is coming from the lateral wall, look for maxillary. Dr. Paras, excellent, very fast response. We will look for lateral wall of maxillary sinus. Maxillary sinus. If it is damaged, maxillary sinus damage, this is squamous cell carcinoma. And if it is not damaged, it is intact, I will go for inverted papilloma. Very simple, straightforward point. So option A and option D can be ruled out because they are coming from the lateral wall. They are not coming for the septum. Yes, Sardana approach is your transpalatal plus sublabial beta, large size tumor. We have to use 2 approaches, one from the palate, one from the sublabial approach. If you are asking me to explain the Sardana approach, I will be just explaining in next 2 minutes. Let me complete this segment. So how to attempt this question? Septum visible, only one option is there. Even if you don't know anything about image, slide, history, you focus on the septum. The smart student, the student who is deserving for top 10 rank, what he will do? He will focus on the word septum and he will say confidently, cavernous hemangioma, sir, inferior turbinate. Yes, one of the students asking me how to differentiate cavernous. Cavernous is from inferior turbinate, beta. Inferior turbinate, and this is coming from the septum, so it will be capillary hemangioma, and rest both are coming from the lateral wall. I hope this is clear. Now, one of the students is asking me to elaborate the Sardana approach. Very simple. Now, I take you back into the angiofibroma segment. If you're master of the basic anatomy, this is my, I take you to my dissection hall. This is my nose. Lateral to nose is my maxillary sinus. This is maxillary. And next to maxillary is my zygomatic arch. This is simple. Everyone listening to me, or those students who are listening to me for the first time, take your finger, touch your nose, maxillary, zygoma. Behind this is your nasopharynx. Behind your nose is nasopharynx. Very simple. I will prove. Like I always say, you should learn medical subjects in form of physics. Prove everything. You will never forget. Behind nose is nasopharynx. Behind maxillary sinus is your pterygopalatine fossa, beta. Pterygopalatine fossa. Now tumor is here. Tumor is invading. This is my dumbbell shape. Now one option, I will use transpalatal. From transpalatal, I will go to the nasopharynx part of the tumor, and via sublabial, keep your finger below the lip, sublabial, I will open the antewall. I am here. I hope you are getting my point. So this combination, big large size tumor, I have to use two approaches. One is sublabial. Even if any third year student is listening to me, they can ask you why you are using sublabial approach. You will say, I want to assess to pterygopalatine fossa. So this combination, which combination? Transpalatal. Which combination, beta? Transpalatal plus sublabial approach is known as Sardana approach. Is going to, if it is only small size tumor, where is a small size tumor? Small size tumor is only in the nasopharynx. It will be only transpalatal. I hope. Kindly thumbs up in the chat box if you got this concept. For nasopharynx, I am going from palate, transpalatal. For pterygopalatine fossa, I am going via sublabial approach. So this combination, Sardana approach, small size tumor, nasopharynx. Very simple if you want to go to the depth of this topic. Otherwise, 10 to 12 keywords should be on your tips. Clear? Question number 2, going in the favor of capillary hemangioma. Done. Question number 3. Structure pointed in the image. For the last 2-3 years, I am observing they are asking one MCQ related with the anatomy, ENT of nasopharynx. Either they will ask you ET tube, they will ask you fossa of Rosenmuller. So let us do mastery of this topic. Beta, what I am showing you now, concentrate. Very good, beta. Thanks for all the compliment in the chat box. Only motive of taking this session, beta, speed, fast learning. Be a fast learner, beta. We are not born to do exhaustive work. We are born to do smart work. So what is smart work? Enjoy. Now what I'm showing you, concentrate on the board. This is my nasal septum, posterior, superior. Beta, what is this one? This is your sphenoid bone. Yes. What is this segment? Behind nose is my nasopharynx. So what I'm showing you something at the junction of roof and the posterior wall. What is this one? C1 junction and roof is my adenoid. So I'm showing you a nasopharyngeal tonsil. I have given you 4 options. Fascial tonsil. What is fascial tonsil? Fascial tonsil is in the lateral wall. Fascial tonsil will be in the lateral wall of tonsil, beta. Always remember, let me refresh 1 second. Yes, in the lateral wall of pharynx. Palatine tonsil on the palate. Fascial tonsil, option A, is a modified version of palatine. Very true statement. What is lingual tonsil? Lingual tonsil is here on the base of tongue. I am asking you adenoid. What is the other name of adenoid? Other name of adenoid is here. Nasopharyngeal tonsil, also known as Luschka tonsil. They can ask you tubal tonsil. Just remember this point, expected MCQ. If there is a tonsil surrounding the ET tube, it is tubal tonsil. And what is the other name of tubal tonsil? Gerlache is a tonsil of Gerlache. And if they ask you adenoid, this adenoid known as tonsil of Luschka. These are 2 important PYQ for NEET examination. These are the important PYQs. Now I take you to one more slide. Now concentrate behind this. Concentrate this one. Can you label? Let us use this platform to learn a nice anatomy. Can you tell me what is number 1? What is number 2? What is number 3? Yes, anyone, any student? If number 1, now just try to appreciate this one, this important concept. If, yes, anyone who can tell me what I'm showing you, number 1, number 2, number 3. I'm waiting for the response in the chat box. Anyone who can comment on number 1, number 2, number 3. I will magnify the slide for you. Yes, I will magnify the slide for you. Yes. Yes, any student, what is number 1? First of all, I'm waiting for response. Write in the chat box. Yes. Who is writing number 1? NLD? Beta, we are somewhere behind the tongue, base of tongue. Nasopharynx. I am showing you lateral wall of the nasopharynx. One of the student, number 3. Number 3, yes. What is number 3? Torus tuberous. Absolutely right. Absolutely right. Yes. What is this one? Can you explain? But number 1, if you just appreciate this slide, just appreciate this slide, number 1 is some muscle related with number 2. Number 2 is your ET tube. Number 3 is torus tuberous. Number 1 is a muscle related with the palate. Always remember this point. Muscle something related with the palate. Number 2 is ET tube. Number 3 is torus tuberous. And if examiner label this area behind ET tube, what is behind ET tube? This area will be your fossa of Rosenmuller. What is the importance of fossa of Rosenmuller? I will label fossa of Rosenmuller somewhere will be here at this point. Behind ET tube opening, behind ET tube opening is your fossa of Rosenmuller. Just appreciate this prominent area is known as torus tuberous. Is known as torus tuberous. Done. Clear? Is this concept clear, beta? Number 2, if I take as a reference point as a ET tube, number 3 will be torus tuberous, and the fossa behind ET tube will be fossa of Rosenmuller. Fossa of Rosenmuller. Coming to the next one. Question number. Yes, very good, beta. The entirely any muscle attached with the palate. Question number 4. A 5-year-old patient with history of hearing loss. Anyone who can comment the diagnosis? But it is a muscle attached on the palate. On examination, it is found to have a chalky white mass. Beta. What is the key word in the MCQ? Key word in the MCQ is chalky white mass. Chalky white mass mention. I will go in the favor of cholestroma. Now let us discuss cholestroma in a nice way. Let us discuss cholestroma in a nice way. Let me refresh. Yes, cholestroma. If it is in a pediatric patient, it is congenital cholestroma. So let us make a concept. Beta, always remember, if there is a chalky white mass in a retracted tympanic membrane, I will go for which diagnosis? You tell me if it is your retracted tympanic membrane. If it is retracted tympanic membrane, I go for the diagnosis of primary cholestroma. If it is perforated tympanic membrane, it is your acquired secondary cholestroma. And if there is any trauma, if I say this is a trauma patient, if this is a trauma patient and there is a chalky white mass behind the tympanic membrane, it will be tertiary. Let me refresh one second. Clear? So chalky white mass in a pediatric patient is always congenital cholestroma. Answer will be in this MCQ will be option A, congenital cholestroma. Clear? If it is primary, now I can divide this cholestroma chalky white. Always remember, with a chalky white mass, pearly white mass in the nose is your nasal polyp. Chalky white mass, keyword for cholestroma, which is squamous debris. If the examiner use the word pediatric patient, go for congenital cholestroma. If it is retracted tympanic membrane with no history of ear discharge in the past, we label it as primary. If the tympanic membrane is perforated or there is a history of ear discharge, we go for secondary. And if there is a history of trauma, we label it as tertiary cholestroma. Like examiner can give a female suffering from otosclerosis. After surgery, patient hearing was normal, but after 1 year, patient landed up with some hearing loss. On examination, chalky white mass. So I will be going in the favor of tertiary. Am I understandable? So this is your important point, key point for cholestroma formation. Which criteria is used? Very old PYQ for NEET examination. Levinson criteria is used for your congenital cholestroma. Done. This concept clear. Now, what is the treatment for cholestroma? Always remember, if there is a squamous debris in the middle ear mastoid, we will be doing go for canal wall down procedure, mastoidectomy. That should be on your tips. Classification should be on your tips. Let us rule out other option. Automycosis. Can you tell me automycosis, which keyword? Let's write in the chat box, beta, what keyword will be there in for automycosis? Automycosis. Yes, aspergillosis niger. Examiner will give which word? It will give you wet newspaper like appearance, black spot, white spot, black spot, white spot. Clear? So it is your automycosis, aspergillosis niger. Aspergillosis fumigatus is for your nose. Aspergillosis niger. So there should be black spot, white spot. That is your Wet newspaper like appearance. Excellent. Everybody is responding in the chat box. Clear. Autosclerosis. Can you tell me the keywords? Which keyword must be there in the history? Pregnant female, bilateral, painless, progressive hearing loss. Examiner will mention the word Carhart notch, or will mention the word pregnancy, or 2000 heard hearing loss. That will be going in the favor of autosclerosis. The fourth option, they have mentioned the word exosteosis. That is your osteoma formation in bilateral ear. So for that, the examiner will give a history of swimming, cycling, or speedy water boats on the which is surfer ear. So that is your option D. Always make a habit of writing in front of every option why it is not the right answer. When you are attempting this question, but don't go with the quantity. Easy, simple, doable MCQs. Motive of this MCQ, I can give you unwanted 6-7 lines of the history and then waste your time. Better, simple, straightforward. Chalky white mass, congenital cholestoma, pregnant female, typical history of hearing loss, autosclerosis. Wet newspaper like appearance, sir, it is automycosis, but you can be trapped. Aspergillosis niger, aspergillosis fumigatus. Fumigator nose, niger ear. Clear. One of the student, very nice. Patient feel better in the surrounding. Very good, excellent. This is the best part of live discussion, beta. Always attend live lecture, it helps a lot. Now one of the student writing in the chat box, sir, patient is feeling better in the noisy surrounding, is going in the favor of conductive deafness. Every conductive patient feel better in the noisy surrounding. What we call it as? We call it as paracusis. We'll see. What is the importance? Sir, patient feeling discomfort, that is Tullio's phenomena, is sensory deafness. So one day before your examination, these formula should be on your tips, beta. These are the 3-4 formulas. We will crack whole audiometry in form of physics, like sensory deafness is equal to oversensitivity is equal to Tullio's phenomena is equal to feeling discomfort in the noisy surrounding. What is conductive deafness? Conductive deafness feel comfortable in noisy surrounding, that is known as paracusis. We'll see. What is neural deafness? Neural deafness, you should be confident, that is, it is fatigability. Examiner either give you the MCQ on oversensitivity or fatigability. Oversensitivity is known as recruitment phenomena, which is a hallmark feature of sensory. And if the patient use the word fatigability, that is rollover phenomena. Can you appreciate now mindset of the examiner, beta? You feel कि how the examiner make the MCQ. He is not opening your books and make the MCQ, not at all. He know कि he want to ask you either recruitment phenomena or rollover phenomena. If it is rollover phenomena, sir, I will jump for neural deafness. If it is recruitment phenomena, I will jump for sensory deafness. These concepts should be clear, beta. What is recruitment phenomena? So recruitment phenomena is your oversensitivity. And what is rollover phenomena is fatigability. In the speech audiometry, patient cannot maintain the plateau. All these points, but in the last spell, one day before the exam, we can't go in the concept, but these formulas should be on your tips. Concentrate on the board. Which is the important test for rollover phenomena and which is the important test for recruitment phenomena? Recruitment phenomena, so sensory deafness. How we make the diagnosis? Short sensitivity, short increment sensitivity index, and rollover phenomena we do for decay test. These are the keyword. If the examiner using the word key, I promise you, beta, just make a star over this. If you are writing my notes, question is there. From these 4 formula, they will ask you one thing. Either paracusis will see, or Tullio's phenomena, or rollover phenomena, recruitment. These things should be on your tips. I hope you are getting the message ki how to proceed. Clear? One day before examination, I can't go in the depth of Tullio's phenomena, but yes, we should be confident. If examiner asks you Tullio's phenomena, it will be only 2 possibility. Like one of the student is writing in the chat box, very nice. Those students who are listening to me and seeing the chat box is a nice motivation for you people. Best part of the live lecture, beta. Tullio's phenomena. Always remember sensory deafness, or it is in fistula. Whenever there is a fistula, it is always Tullio's phenomena. Like superior semicircular dehiscence syndrome or fenestration surgery, we get Tullio's phenomena. Revise with me, beta. Tullio's phenomena. Patient feeling uncomfortable in noisy surrounding. Therefore, it is either fistula or it is sensory deafness. Fistula or sensory. Very old PYQ. Like I will share that PYQ with you. The examiner asks you Tullio's phenomena. Patient feeling discomfort in a noisy surrounding is seen in all of the following except first option, Meniere's. Sensory deafness. Yes, true. Superior semicircular dehiscence syndrome. Yes, sir, possible. True is a fistula. Then post-fenestration surgery. Yes, trauma can be there. And the fourth, acoustic neuroma. So answer will be acoustic trauma, because acoustic trauma is neural patient. So examiner will give you rollover phenomena, not recruitment phenomena. I promise this MCQ will help you to crack the question. Clear? Coming to the next level, question number 4 clear? Is it clear? Done? Enjoying everyone? I love beta all the students on this platform interacting with me in the chat box. Beta comfortable? Only motive of conducting this session to give you the momentum beta. I feel some students, if you are not getting this momentum at this point, sir, is not possible, this NEET examination we may not get a good rank. Take my word beta, don't have any guilt. No guilt should be there. Work hard. अगर last 1 week भी study नहीं किया तो कोई बात नहीं बेटा, forget. Work hard, especially for those students who couldn't perform well in INICT examination. कोई बात नहीं यार, एग्जाम हो गया, अगला INICT भी आने वाला, फॉर्म भी रिलीज होगा अभी जल्दी, तो जस्ट फोकस ऑन द नेक्स्ट INICT, फॉरगेट पास्ट. क्लियर? आई एम अंडरस्टैंडेबल? क्लियर? और अच्छी रैंक नहीं आई है ना, forget बेटा everything. Now focus on the next examination, and always remember all these examination, NEET और INICT is just 1% of your life. उससे ज़्यादा इन एग्जाम की आपकी लाइफ में इंपॉर्टेंस नहीं है. Honestly, I'm telling you. Coming to the next level, enjoying? Yes, low voice. With audio video absolutely fine. And low voice, you tell me, low intensity voice, the patient have a low voice is conductive patient or sensorineural? Is conductive patient. Loud shouting patient, sensorineural. In my OPD, if somebody is shouting, he is a sensorineural patient. If somebody is using low intensity soft voice, is conductive patient. Question number 5, facial palsy with ear canal edema. A image is given. What is the key word for the image? First we appreciate the image, then the word diabetic is there. You are a dedicated student. Diabetic देखते ही बेटा mind में क्या differential diagnosis? Diabetic word. MCQ from ear. Sir, it is malignant otitis externa. No other option. MCQ from the nose. Always make a diagnosis of mucormycosis. MCQ from oral cavity. It is Ludwig abscess. Can you appreciate better? Formulas. We have to concentrate on the keyword and dissect and divide everything in the formulas. At the end of the day, before examination, ENT should be concise in 10 to 15 pages. Only focus on the keyword. Then only it is possible for you to handle 19 subjects. Malignant otitis externa. Before starting the MCQ, which are the keywords? 6 to 7 keywords should be on your tips. Diabetic patient, foul smelling discharge with facial palsy, granulation on the canal. Technetium 99 for diagnosis, so gallium for prognosis. My patient is poor, he can't afford. In medical college, we use ESR. After how many weeks ESR comes down? So 2 weeks. Bacteria, Pseudomonas, drug of choice, cephalosporin, with surgery indicated debridement. आपकी लाइफ में malignant otitis externa की इससे ज़्यादा इंपॉर्टेंट नहीं है. Revise with me. Diabetic patient, foul swelling, granulation, facial palsy, technetium 99 for diagnosis, gallium for prognosis. ESR again prognostic marker कितने weeks के बाद? नीचे 2 weeks के बाद. Drug of choice, cephalosporin, not responding. We can try another penicillin or ciproflox, but surgery of choice will be debridement. That's it. Topic over. What examiner is asking, which bacteria? Simple, easiest question. Nothing can be more easy than this. Answer will be A option. Clear? Comfortable? Basal cell carcinoma. I will use this option just to give you a message. This is a favorite question of INICT, favorite question of NEET examiner. What is the keyword? Keyword invading the skin. In your NEET examination, if examiner use this word invading the skin, always go for basal cell carcinoma. That is your root and ulcer. Very simple, straightforward. Clear? Malignant otitis externa. If you ask me to go one step ahead, there is no upper limit. I can teach you the staging of malignant otitis externa. Stage 1, this technetium 99 is negative. Stage 2, technetium 99 is positive. Stage 3 is cranial palsy, and stage 4 is intracranial complication. But I will suggest you to focus on the basic points. They will either ask you Pseudomonas or they will ask you the drug of choice or treatment of choice. That is very simple, straightforward concept. Clear? It is rodent ulcer. Very nice. Basal cell carcinoma. Done. First half, can you appreciate? It is 30 minutes. We have completed 5 MCQs. Time management. So beta, I am giving you one important advice you should follow religiously. Next 2 months, beta, do discipline learning. Make a perfect timetable before sleep. And next day, follow the timetable. If you have given morning 9 to 11, my nasal cavity revisor knows, at 11 o'clock, you should switch over to the next topic, discipline learning. Then only you will become a fast learner. Clear? So follow the discipline learning. Half an hour. My target was 5 MCQs. We have done with the 5 MCQs. Coming to the next MCQ. All infection caused by Pseudomonas is commonly like malignant otitis externa, perichondritis, diffuse otitis externa. They are caused by Pseudomonas mainly in the ear topic. Clear? Question number 6. Expect one MCQ either on BARA or auditory pathway. This NEET examination, just make a start. One MCQ expected from this segment. But I'm showing you, I'm keeping some electrode, I'm getting some waves, like I'm doing ECG of the auditory system. Yes, what is the better term? Better term is brainstem, evoke, response, audiometry. Clear? So this investigation, first of all, this investigation is for my neural deafness. That neural deafness. What is the auditory pathway? ECOLI. They can ask you this MCQ, very potential. E for eighth nerve, C for cochlear nucleus, O for olivary, L for lateral lemniscus, I for infracolliculus. What is the drawback of this investigation? It cannot diagnose medial geniculate body and auditory cortex. Done. These are the important points. For this, what is the investigation of choice? We do SARA, cortical evoke response audiometry. So instead of BARA, we will prefer cortical evoke response audiometry. I hope you're getting this point. Now, which is the largest wave? If the examiner asks you, this is wave 1, wave 2, this is wave 3, this is wave 4, this is wave 5, this is wave 6 and 7. Very important point. Which is the largest wave? Largest wave is the fifth wave, is the largest wave. If the examiner asks you, like I have asked you most sensitive wave. Most sensitive is wave 1 beta. Wave 1 is most sensitive wave. Which are the reliable waves? If the examiner asks you the reliable waves, the first 3 odd number are the reliable waves. 1, 3 and 5. 1, 3 and 5 are the reliable waves. These are the important MCQs which should be on your tips. Clear? Let us discuss one more MCQ. Eighth nerve. Eighth nerve is the right answer, beta. Eighth nerve is stimulated in cochlear implant. Very important. I am highlighting because expected MCQ. And brainstem implant stimulate cortex, that is your cochlear nucleus. If examiner asks you cochlear implant stimulates, that is your eighth nerve, and if the examiner asks you brainstem implant stimulate, that will be a cochlear nucleus. One MCQ expected from this slide. Please go through your BARA. They can ask you either brainstem evoke response audiometry, they can ask you invasive investigation like electrocochleography, which is for sensory deafness, and one is impedance audiometry, that is for conductive. So beta, this slide is very important. For conductive deafness, we have impedance audiometry, that is tympanometry. All the type of tympanogram should be on your tips. They can show you one graph, they can ask you to identify. Sensory deafness, the investigation of choice, electrocochleography. Neural deafness is BARA or SARA. In between, you should be master of autoacoustic emission, which is a screening procedure for sensory deafness. Autoacoustic emission coming from outer hair cell. The drawback of autoacoustic emission, they may be absent in normal cochlea. They may be blocked by middle ear pathology. All these are the important points for OAE, autoacoustic emission. On this platform, I'm telling you for the high yielding topics. These are objective investigation, objective beta. If any student attending the session and you have not read ENT till now, beta, at least these topics should be on your tips, beta. Clear? Can we make a list of important MCQs? Which are the 6 mandatory, beta? This question should be on your tips. Audiometry, subjective audiometry, objective audiometry. One MCQ from subjective, one from objective. Expect management of CA larynx, beta. This is one of the important topic for those students who are feeling uncomfortable in ENT. They're listening to me for first time. At least these topic should be on your tips. Management of CSOM. Epistaxis is very important topic. One is ethmoidal air cell, Anodi cell, Haller cell. All these are important. And one is your abscess of the pharynx, retropharyngeal abscess, parapharyngeal abscess. These topics should be on your tips, beta. These are must read topic of ENT. Clear? Coming back to the next segment, question number 7. A healthy 32-year, previously healthy 32-year-old female with a rotatory vertigo. Now let us dissect each and every choice. Rotatory vertigo, what does it mean? So it means which canal is involved? So superior semicircular canal is involved. It means it give me a message that superior canal is involved, associated with nausea, vomiting. The symptoms have started 5 days earlier. Vertigo attack, otoscopic normal, no nystagmus in the neutral position. Long history is given. A motive behind this MCQ. What is motive behind this MCQ? What is the answer of this MCQ? Question number 6. The right answer, most sensitive wave. is your wave 1 beta. Wave 1 is most sensitive. Wave 1, wave 3, wave 5 are reliable waves. Among this, wave 1 is sensitive wave. Now examiner is giving a typical history, then Hall-Pick maneuver does not evoke, so we can't make a diagnosis with all. Hall-Pick maneuver is coming negative in this patient. Identify the investigation. Long history given, the investigation image is there. Always make a rule. Whenever the image is there, always focus on the image first. Sometimes you crack the MCQ directly with the help of image. What is the last line of the MCQ? Last line of the MCQ, identify the investigation. So what I'm doing, beta, I have kept one electrode in the ear, one electrode on the sternocleidomastoid. It means I am evoking the ear. I'm getting some response of the sternocleidomastoid. I'm doing VEMP, vestibular evoke myogenic potential. So what is importance of VEMP? That is the investigation of choice for vestibule. So let us make a concept. VEMP, vestibular evoke myogenic potential. It is for vestibule. It is an investigation of choice for vestibule. We are stimulating the inner ear gives the signal to brain gives signal to sternocleidomastoid via ear. Which nerve? Now let us crack. This VEMP is of two types, beta. One is ocular, one is cervical. I am expecting this year they will ask you something on VEMP. Beta, ये question है, ये table को revise properly. Cervical is your sternocleidomastoid. Which muscle is tested? Ipsilateral sternocleidomastoid. Ipsilateral sternocleidomastoid. Which nerve is responsible? Inferior vestibular nerve takes signal to the brain. Spinal accessory, that is sternocleidomastoid. That is a different concept. What is vestibule? Giving signal to the brain via inferior vestibular nerve. And this is a inhibitory response, beta. Inhibitory response. Ocular, we are keeping the electrode on the extraocular muscle. That is your excitatory response. Excitatory response via extraocular muscles. It is via superior vestibular nerve. It is excitatory response. So we have two type of VEMP. One is cervical, one is ocular. This VEMP stimulates the electrode number 1 in the ear. It stimulates which part of the ear? It stimulates saccule, beta. Basic bottom line, this slide is important for your NEET examination. If you have not read this investigation till now, just revise 4-5 points with me. VEMP, vestibular evoke myogenic potential, investigation of choice for vestibule. Like for cochlea, we have electrocochleography. So examiner can ask you a multiple choice MCQ. Which of the following investigation can be used for inner ear? Inner ear, two parts: cochlea, vestibule. Cochlea, electrocochleography. Vestibule, VEMP. Electrode stimulate, it stimulates saccule. How many type of EMP we have? So two type of EMP. One is cervical, one is ocular. Then difference between these two should be on your tips. Clear? I feel everybody is enjoying, beta. Yes, I'm confident. Coming to the next MCQ, question number 8. Study the given tracheostomy tube it is being used for. We will attempt this question later on. Before that, tracheostomy, which are the 10 keywords should be on your tips. If you are going for NEET examination, beta, what is the best area for giving incision? The best area for giving incision is between second and third ring. High level tracheostomy done for malignancy. Low level is for diphtheria. Diphtheria से याद आया दो MCQs. Bull's neck and bleed on removal. Bull's neck, bleed on removal, two important key points. High level for malignancy, low level for diphtheria. Vertical incision for emergency and horizontal for elective. If tube is blocked, then complete blockage, I will remove the tube. Partial blockage, I will do the suction. I hope everything is clear. Dead space is reduced by what percentage? So 30 to 50% dead space is reduced in case of tracheostomy. And tracheostomy, normal epithelialization is formed, abnormal track is formed, epithelialization occur by 7 to 10 days. Most common tube is your PVC cuff tube. What is the drawback of cuff tube? Pressure necrosis. Advantage, it reduces aspiration. Because it causes pressure necrosis, we go for low pressure, high volume tubes. And how frequently we should deflate the cuff? Every 2 hourly for 5 minutes. These are the keywords. I'm revising with you, beta. Every student should repeat with me. Between second and third, high level for malignancy, low level for infection like diphtheria, bull's neck, bleed on removal. Vertical for emergency, horizontal for elective. Always remember, if tube is blocked, Complete blockage, remove the tube. Partial, do the suction. Then which dead space is reduced by 30 to 50. Very simple. And epithelialization track is 7 to 10 days. Best tube, cuff tube. Advantage, respiration, reduce aspiration. Drawback, it can cause pressure necrosis. How frequently we should deflate the cuff? Too early for 5 minutes. What is this tube I am showing you? I am showing you a fenestrated tube. What is the use of fenestration? You tell me. Physics principle, narrow space. When the air is moving from the narrow space, sound is produced. It is used for voice. So we'll be using for voice. Simple funda beta. 1 day before examination, tracheostomy should be revised in 1 to 2 minutes beta. It is only the point which I am telling you beta. It is practically possible to revise tracheostomy in 1 to 2 minutes, and if you do this, you're on the other side of the game with top rank in 500. I honestly am telling you with this point beta. We have to revise in a very fast mode. Revise the things in a very fast mode. Clear? No regret, no guilt. Koi topic nahi aata, take a red color marker, make a big cross, don't touch the topic, jump to the next topic. एक क्वेश्चन आएगा छोड़ देंगे, but it should not happen. For that one MCQ, we are leaving other 2 MCQs. It should not happen. Be practical, be professional in the last spell of your NEET preparation. Done. So right answer will be for voice. And let us dissect other choices. Preventing aspiration. Is this tube used for preventing aspiration? Not at all. Which tube is best for preventing aspiration? Is your cuff tube. So in front of this option A, we can write it is cuff tube. Voice, it is used for voice. Reducing the pressure necrosis. No. Reducing pressure necrosis is your uncuffed tube. Even this tube will not have any pressure necrosis, but better option between B and C is your B option. Home care, very nice choice. As a student, you can't appreciate option D, but as a faculty, home care beta, we use metallic tubes for home care because it is easy to remove and easy to clean the tube. So home care, we are using metallic like silver Jackson tubes or Fuller's tube for home care. Done. So we have dissected this MCQ. Motive of this MCQ was to give you 9 to 10 important MCQs. I hope everything is clear. Any query? Any point you want me to repeat? Anything you want me to repeat, Vida? Silver Jackson metallic tube. Absolutely right. Coming to the next one. Question number. Yes, the nice question. One of the student is asking, Dr. Siddharth, in children, which tube is preferred? But in children, the concept is not of the which tube. Even if there is a chance of aspiration, we have to use cuff tube. But what is the basic funda in children? Everyone, I will write for you. You people should write. In pediatric patient, beta, in pediatric tracheostomy, just remember 2 points. 1, we always prefer vertical incision. We prefer vertical incision. Always. Clear? Next, never remove the tracheal cartilage. We never remove the tracheal tissue. Never remove tracheal tissue. Otherwise, maldevelopment of trachea will be there. So, tracheal cartilage tissue is not removed. These are the 2 important points which should be on your tips. Clear? Coming on the question number 9. Prosthesis given below. Anyone who can tell me what I am showing you? I am showing you something, a T-shaped prosthesis which is inserted. I am giving you a clue. Can you identify this prosthesis? Question number 9. Any student? I am giving a T-shaped prosthesis which is between trachea and esophagus. Which prosthesis is this one? This is your Blom-Singer tracheoesophageal prosthesis. It is used for, you tell me, it is used for vocal rehabilitation. So after total laryngectomy, we are using Blom-Singer tracheoesophageal prosthesis. This is tracheoesophageal prosthesis. For the last 2 years, they are asking MCQs on this tracheoesophageal prosthesis. We have 3 important words which should be on your tips. One is Blom-Singer, one is FMGE voice button. FMGE voice button. One is known by the name of Provox. PROVOX. Beta, ye 3 naam yaad rakhne more than sufficient. Now let us do mastery of this MCQ because they will ask you one question. This is my trachea. This is anterior wall. This is posterior wall. Can you tell me on which wall? In anterior, this is my post-laryngectomy patient. I have removed the larynx of the patient. This was larynx. We have removed the larynx. This is closed area. Now, on the anterior wall, I am putting something and I am putting something on the posterior wall. Can you tell me what is A, what is B? Any student? On the anterior, after this is a line diagram of trachea, after total laryngectomy. Identify A, identify B. If this is anterior, this is posterior, what we are putting on this can be image based MCQ. On the anterior wall of trachea, yes beta, Dr. Rajat, what is on the anterior wall? Obviously it will be tracheostomy tube na beta, tracheostomy. On the posterior is esophagus, tracheoesophageal processes. Last NEET examination they have shown you a opening on the trachea anterior wall, and there is a small opening on the posterior wall, and they ask you which surgery was done in the patient. Answer was total laryngectomy, because we have put a device on the posterior wall, so that was post laryngectomy patient. I hope you are getting my point. Can I make this MCQ little bit complicated? Which of the following is the order of putting the tube? You tell me. First we will put which tube of, if you put the tracheostomy tube, beta, how can you put something on the posterior wall? So first we will be putting tracheoesophageal processes followed by tracheostomy tube. This can be again one of the important point. Clear? So this on the anterior wall we are putting the tracheostomy tube, on the posterior wall we are putting here tracheoesophageal processes. Done. This concept clear? Now what are the other methods of vocal rehabilitation? So just remember, we can use electrolarynx. Electrolarynx is your device, electronic device we are putting on the neck, and the vibration can be used in form of words. One is the oldest method, not is successful, failure, that is your esophageal voice. What is esophageal voice? Esophageal air in form of voice. And how many words we can use? That is 6 to 8 words. Let us revise in a nice way. I'm repeating again. Concentrate on the board. The first point, important point, just remember, on this segment, how many methods are there? One is esophageal voice, oldest method. One is electrolarynx, and the latest is your tracheoesophageal prosthesis. Clear? Tracheoesophageal prosthesis, and 3 type of prosthesis on your tips. One important point with respect to total laryngectomy, you should be confident what is polite yawning. Anyone who can write in the chat box what is polite yawning? This was a PYQ last to last INICT, so they can ask you what is polite yawning. Name is polite, is not polite actually, the method is not polite. What is polite yawning? Yawning with closed mouth. It is used for olfactory refunctioning. Like INICT people ask you, polite yawning is used for. Polite yawning is used for olfactory refunctioning. Done. So polite yawning is yawning by closing the mouth. This is something related with question number 9. Done. As for management part of CA larynx, we can discuss carcinoma in situ. Always remember we go for CO2 laser. And T1, T2, always remember we prefer radiotherapy in glottic tumors, or radio-resistant cases or any other tumor, we choose partial laryngectomy. And T3, T4, always remember, always pray God MCQ should be from T3, T4. What is the management for T3, T4? Total laryngectomy with radiotherapy. Total laryngectomy with radiotherapy. Revise with me. Carcinoma in situ, CO2 laser. T1, T2, it is your either radiotherapy like glottic tumors, and other than glottic tumors, we go for partial laryngectomies. And T3, T4, we go for total laryngectomy followed by radiotherapy. If the patient deny for surgery, patient is not interested for surgery, we can go for concurrent chemoradiation. So these are the important points related with here total laryngectomy. CA larynx, very important topic. Coming to the next one, question number 10. 48-year-old man with complaint of foreign body sensation in the nose, blood discharge on examination, reddish pedunculated mass, white spots, mass is somewhere attached with the inferior turbinate which bleed on touch, taking history of bath in the ponds. Beta, very keyword given in the MCQ, bath in the ponds. I will not create an unwanted pressure on the slide because being an ENT surgeon, I don't know anything about this slide. I will jump on diagnosis, rhinosporiosis. We will go for rhinosporiosis, mulberry-like mass coming from the nasal cavity. Mulberry-like mucosa, it would have been hypertrophic rhinitis, and mulberry-like mass is your rhinosporiosis. But answer will be in this MCQ will be rhinosporiosis. I am showing you one slide. On this slide, you should write NEET 2024. The exam MCQ, either of these three, they will ask you one. Hypertrophy of sebaceous gland. If they show you some point sebaceous gland hypertrophy, it is your rhinophyma. If they show you some ulcerative lesion, it is rhinoscleroma. And if they show you a red polyp, is mulberry coming from the nose, we call it as rhinosporiosis. Management of option A, surgical excision. Very good. Rhinoscleroma is Klebsiella, is associated with Klebsiella. And here, what is important point for rhinosporiosis? We have to remove it. Surgery with cautery at the base. Which drug is beneficial? Sir, Dapsone. Very nice. Everybody is responding in the chat box. Rhinosporiosis, history of taking bath in the ponds. Is mulberry-like polyp coming out? Was considered as fungal, but is now protozoal infection. Treatment of choice, surgery with cautery at the base. Which state? Tamil Nadu will be mentioned in the MCQ. Drug of choice, Dapsone. This is rhinoscleroma, typical presentation of rhinoscleroma. All these are granulomatous condition of the nose. Important table I want to give you. If you get foul smelling crust beta, everything you should write in form of flowcharts or tables or formula. Flowchart, if foul smelling discharge, foul smelling nasal discharge, the word merciful anosmia, tick atrophic rhinitis. And if the word woody nose is there, go for rhinoscleroma. Just write बेटा either of these two. इन दोनों में से एक पूछेंगे आपसे, या तो आपसे atrophic rhinitis पूछेंगे. How will attempt merciful anosmia word? And if the word woody is there, go for rhinoscleroma. Woody nose, rhinoscleroma. One day before NEET examination. So wood word in ENT. If you are a damn student, wood word in ENT. Sir, woody nose, woodruff plexus, wood industry, adenocell carcinoma of ethmoid, woody swelling below the chin is your Ludwig abscess, and one is Woodman procedure, that is Arichnoid surgery. These 5 points should be on your tips if you are going for NEET examination with a motive of getting rank in top 500. Clear? So the motive of conducting this session was to give you a message, okay, beta, what is fast learning and how to read the things in a fast mode. You get ample time so that you can revise the things nicely. Take my words, beta, at least we have to revise 4 to 5 times. Take my words, beta. And just if you have not touched the topic because of any circumstance, unavoidable circumstance, you couldn't revise in the last 2-3 months, do one favor, beta. We are coming with our DVT session. Before DVT, just do one revision. The students who have done minimum one revision, they're attending DVT, and attend the DVT live, beta. Don't postpone the things. Attend the session live. We promise you, beta, you will get a decent rank. You will get your dream branch. But you should revise the things in a fast mode. In the DVT, when we will make you revise everything in 1 week, you will get a momentum. You will get a message. Yeah, it is very much possible. So again, special message for those students who couldn't get good rank in INACT examination, beta. वो दिन नहीं था, कोई बात नहीं. We will crack NEET examination and will get a good rank. Thanks a lot for coming on this platform. You can follow me on the Insta on this ID. You can inbox me, and again make a promise in the chat box. Keep it up. We will try our best to be a fast learner. We will go with a qualitative learning, not quantitative learning. We will attend DVT live, beta. We will not postpone the things and will complete. Thanks a lot. We stop at this point. Thank you, beta. And best wishes for NEET examination. And those deserving students who couldn't crack INACT, next INACT, we will call you for the interview in the Delhi studio. Clear? Best wishes.